What is Tay Sachs disease? Tay Sachs disease is a rare inherited disorder that destroys nerve cells in the brain and spinal cord. There are different forms of Tay Sachs, however, the most common form is apparent in infancy. Infants appear normal up until around age 3 to 6 months when their development slows and muscles weaken. Tay Sachs disease is very rare in the general population. The genetic mutations that may cause this disease are more common in Eastern and Central Europeans. Mutations in the hexa gene cause this disease. The hexa gene provides instructions for making part of an enzyme called beta-hexosaminidase A, which plays an important role in the brain and spinal cord. This enzyme is located in lysosomes. Without this enzyme, chemicals called gangliosides build up in the nerve cells in the brain and destroy the brain cells. The mutations of this gene disrupt the activity of the beta-hexosaminidase A, which prevents the enzyme from breaking down GM2 ganglioside. The substance accumulates to toxic levels in the brain and spinal cord, which causes the signs and symptoms of Tay Sachs disease. Symptoms of Tay Sachs. Most affected infants have nerve damage starting before birth, resulting in the child passing away by 4 or 5 years of age. Some symptoms include deafness, progressive blindness, decreased muscle strength, seizures, paralysis, loss of muscle function, slow growth, and many more. Other forms of Tay Sachs disease do exist. It can occur in late-onset juveniles. It can be chronic, and there are adult forms. However, it tends to be more rare but milder in severity. Treatment. There is currently no cure for Tay Sachs disease. It typically consists of keeping the infant/child as comfortable as possible. Child may be put on palliative care, which is most common for elderly people. Palliative care consists of pain meds, physical therapy, feeding tubes, and respiratory care to help keep the lungs stay active, and also emotional support for the family. The genotype of Tay Sachs, it is an autosomal recessive genetic disorder. The parents are carriers. There is a 25% risk of giving birth to an affected child with each pregnancy. The affected child would have to have received a mutated copy of gene from each parent.